All right, thank you everyone for coming. Sorry, our technical difficulties. So today we have what we're doing is this part of the Vedanta for Elderly Care program that we started about a month ago, where we had a lovely program with looking at healthcare through the Vedantic lens, specifically the emotional, legal, spiritual, and one more um, uh, medical lenses. And so what we're going to do, what we hope to do, is every month we hope to have a guest speaker come in, a specialist who's going to talk about healthcare and how educate us a little bit about as patients what happens, also as caregivers what we can do, and also looking at a little bit from the spiritual perspective as well. So before we begin, let's start off with a chant as a way to offer this to the divine. If you know the chant, just mentally chant along. Om Asato Ma Sadgamaya Tamaso Ma Jyotir Gamaya Mrityor Ma Amritam Gamaya Om Shanti Shanti Shanti. Lead us from the unreal to the real. Lead us from darkness to light. Lead us from death to immortality. O Lord, shine through and through, and ever protect us with thy beautiful grace. Om, peace, peace, peace to all beings everywhere. So, welcome again. And today we have with us is Rachel Lehnert, who is a social worker and aging and independent specialist. And she actually works for the Aging and Independent Services. She helps to oversee the dementia programs and initiatives. And her programs cover all over the San Diego County. She actually is pursuing her master's in aging and dementia. She goes around communicating, educating the community. And she does, another thing she does is she works with music and memory programs. And she's experienced in socializing programs, care management, and she's really a very informative and knowledgeable person. So today she's going to speak to us a little bit about the how to be a dementia friend. So we're going to learn a little bit about that today. And so we'll have her, she'll give a presentation, and at the end of the presentation, she may have you do some exercises. And at the end, if you have any questions, you can ask her the questions. So I'd like to welcome Rachel. Rachel, thank you so much for coming. Sabir, can you spotlight her?
Thank you for having me. Let me make sure my presentation, hold on. You know, this is kind of how dementia is. It's unpredictable, things happen, and we just gotta roll with it and be patient, right?
Yes.
I also need to share my sound because I'm gonna show a couple videos. There we go. Okay, can everybody see this presentation all right?
We can see it.
Perfect. Okay, well, I'm going to dive right in. Since we are running a little behind, I'm going to skip, too much of an intro. And I would like everybody to start us off. When you hear of the word dementia, what sort of words or phrases come to mind? And you can utilize the chat, you can come off mute, whatever the first thing that really pops into your head when you hear that word dementia.
Best use the chat button underneath.
Forgetfulness.
So it's cognitive loss, doom, cognitive decline.
I can only, let's see. For some reason, I'm only getting direct messages. So if you can monitor the chat, that'd be great. But
Oh,
all right,
sure.
so we have forgetfulness, cognitive decline,
Memory,
memory. Let's do one more.
a heartbreaking experience for all concerned.
A heartbreaking experience. Okay,
Repeat.
so are these words mostly positive or negative?
They sound
Negative.
negative.
Yes, exactly. So when majority of us hear the word dementia, when majority of us really think of aging, usually we kind of have a bleak image in our mind. And so the purpose of this presentation today, the purpose of Dementia Friends is really to break that stigma. And while living with dementia, being a care partner of someone with dementia can be challenging, it can be heartbreaking. We want to provide opportunities. We want to provide an environment where the person can live well, can still have their sense of identity, can still be a part of society, because just because you have dementia doesn't mean that you're not valuable anymore, that you don't have purpose. You absolutely do. And so Dementia Friends is really going to try and help us understand, how we can see that value in that person and make sure we are being a dementia friend and keeping them engaged in their community, in their families, and in their all around. So just to give you a quick overview of dementia, some of you may know, some of you may not, but dementia is an umbrella term that is used to describe a collection of symptoms that interfere with your ability to carry out your daily tasks. So memory loss is usually the first one that we will typically see, but there are a lot of other symptoms. There could be symptoms of issues with communication and language, mobility, vision, behavioral changes, problems with, issues or changes in our personality. So a plethora of different symptoms. And those collections of symptoms are usually caused by different diseases. So Alzheimer's is the most common type of dementia, but there are other types of dementia. There's Lewy body, vascular, frontal temporal, Parkinson's with dementia, Huntington's. There's Korsakoff syndrome, which is an alcohol-induced dementia. So lots of different types of dementia. So everybody who has Alzheimer's has dementia, but not everybody who has dementia has Alzheimer's disease. Another way in which I explain it that helps people to kind of conceptualize it, because it does sometimes get used interchangeably. If you have a cold, you have a collection of symptoms. You'll typically have maybe a runny nose, you'll have a fever, the body ache, the cough, a sore throat. But what is actually causing that cold? Is it COVID? Is it the flu? Is it an infection? Is it allergies? And so that's how we kind of look at dementia, those collection of symptoms, and something is causing those collection of symptoms. Now, you can see the image here that we have a picture of a healthy brain and then advanced Alzheimer's brain. And you can see that there are major physical changes when it comes to Alzheimer's disease. So it's shrunken, it's smaller, there's gaps in between, the parts of the brain. And that is really what's causing these symptoms to occur, because the brain is changing and it's not functioning as it used to be, causing all of those symptoms that make it difficult to carry out those daily activities. So what exactly is Dementia Friends? I'm not going to go too much into this, but it is a global movement that started in the United Kingdom. And it's really this global effort to help society understand 5 key messages about dementia, which we will go over, how it affects people, and how we can make a difference in their lives. So there's over 20 million Dementia Friends globally that all provide this program, do education in the community, to bring awareness about dementia. And anybody can actually become a Dementia Friend champion to give these presentations. They just go through a 2-hour training, and then you can go out into your communities and provide these sessions free of charge and really start, educating our community. So we are going to go over just the typical signs of aging versus signs of dementia. I'm not going to go too much into it just for sake of time, because I want to get really into the deep part of the presentation. Before we go over that, has anybody heard of this word, anosognosia? Anybody know what it means? You can kind of make a guess based off the picture, but Anosognosia is really someone's inability to understand their condition. So a lot of times we see in dementia, or we hear from care partners or service providers, they're doing things on purpose, or they're just in denial, when really the brain is telling this person that they actually are okay. The brain's telling them, yeah, I have showered every day for the past 3 months, when in fact I haven't. And so keeping this in mind when we are supporting and engaging with persons living with dementia, that they might not have the insight into their own condition and they're not doing things or in denial. And so I'm going to go over the signs and the symptoms. So the first one is memory loss that disrupts daily life. I do want to preface. So the biggest takeaway when it comes to typical aging versus signs of dementia is signs of dementia is going to be consistent. There's going to be a pattern, where typical aging is usually something occurs here and there, from time to time. And so that is really the major key difference when we're looking at these signs. So the first sign is memory loss that disrupts daily life. So this is typically the first sign that we might see with someone exhibiting signs of dementia. Memory loss, especially that recently learned information, consistently forgetting important dates, events, appointments, asking for the same information over and over again. And then typical aging would be, occasionally we're going to forget things from time to time. We're going to forget our appointments. We're going to forget someone's name. Oh, their name is just at the tip of my tongue. But we are usually able to remember them later. Wake up in the middle of the night, oh, that was her name. And so it's something that, again, is not as consistent. And then the second sign is challenges in planning or solving problems. So persons exhibiting signs of dementia may experience the ability in their, sorry, where am I? I lost my place. Sorry. Challenges in planning or solving problems. Sorry. So we might notice that this person is, sorry, my computer is being very strange right now.
I thought you were just giving us a demonstration of what dementia versus age.
Exactly. See? And what I'm going to do in this situation is I'm going to breathe, and I'm not going to work myself up, because that solves nothing. Sometimes when we are working with individuals living with dementia, we might get frustrated. We might not understand why something isn't working. And so that can cause us and make it even harder. So sometimes taking a step back, taking a deep breath so we don't get overwhelmed, is a good thing to do. So I'm really trying to practice what I preach. So back to challenges in planning or solving problems. So we might notice that bills are piling up. Maybe they, with planning and solving problems, they might lose track of the ability of due dates, how to pay their bills. They might have difficulty following a recipe. And then with typical aging, from time to time, we have so many things on auto pay. Maybe there's one bill that's not on auto pay that we forgot to pay, but it's not because we don't know how to pay the bill. It's just we forgot about it. Where dementia would be, we're not really understanding how to pay our bills anymore, balance our checkbooks, pay bills online, or not able to follow step-by-step process. Okay, I think I'm back on track. The third sign is difficulty completing familiar tasks at home, at work, or at leisure. So persons exhibiting signs of dementia might have issues with their familiar daily tasks. They might forget how to use appliances like a microwave or a stove, even, things like playing their favorite game. Or we might see them getting lost in familiar places. They're going to the grocery store, and that's the grocery store they've always gone to. And then all of a sudden they just get lost and they're not sure, how to get home or what they're doing at the grocery store. And then typical aging, there's always new forms of technology coming out. There's a new smartphone, and from time to time, we're going to need help with learning this new technology and how to learn it. And then the fourth is confusion with time or place. And so persons exhibiting signs of dementia may lose track of dates, seasons, and just the overall passage of time. They may have challenges understanding something if it's not happening to them right in that moment. So they also may go somewhere, forget how they've got there. They may forget why they're there. We might see this a lot, especially in individuals who are in their own home and they are asking to go home. And really what's happening is they're traveling back to a different time where maybe they lived in a different home. And they think that they are in a place that's unfamiliar, even though they're in their own home. And then typical aging, a lot of us might be retired, or, there's no reason to keep track of the day of the week. So we might forget it's, the day of the week, but we're able to recall that later. And then the fifth sign is trouble with understanding visual images and spatial relations. So persons exhibiting signs of dementia might have difficulty reading, judging distance, determining color or contrast. So for example, if you are giving someone food and you have a piece of chicken on their food and the plate is white, they might not be able to identify that piece of chicken because it's blending into the plate. And then you might think that they're not wanting to eat, something's wrong, but really they just can't see the food on their plate. This might also cause issues with, driving, judging the distance between cars, or even patterns. Patterns are huge. If there are pattern floors or pattern walls, it could look like something scary. It could look like maybe there's persons in the hallway. On the floor, it could look like holes. It could look like steps, or maybe objects on the floor and they try to step over it. So the brain is not able to process the images that they are seeing in their environment, and that can cause a lot of issues. And then typical aging is just, is changes in relation to your cataract. So things might get blurry. You might, be more sensitive to light. It's going to be harder to drive at night, but it's not because of the process of your brain. It's just your eyes and the physical part of your eyes are getting older. So I'm going to do a little activity with you all. So I'm going to have you take your hands like this and just go like this. So this is, someone that maybe is a little bit older. It's kind of hard, you can still see pretty much everything in front of you. And now I want you to take just one and go over your eye. So this is what it can be like living with dementia, especially in those later stages. So your peripheral vision, you cannot see anything. You can only see directly what's in front of you. And so if we are communicating with someone, or if someone's in an environment and they're living with dementia and there's lots of noises, there's lots of people around, that might cause agitation. Or we might say, oh, they're paranoid, they're hearing things, when really they just can't see what's in their environment. And so, as we mentioned, Alzheimer's and related dementias is more than just memory loss, and a lot of people don't realize it affects the way that they see the environment. And then the sixth sign is problems with words and speaking and writing. So individuals exhibiting signs of dementia may have trouble following conversations, joining conversations. They may stop in the middle of a conversation and have no idea how to continue. Or, as we know, they may just repeat themselves. They may struggle with vocabulary, finding the right word for things. So they might call certain objects by different names. So for example, they might refer to a watch as a hand clock. They might also speak in word salad, which is just putting together a bunch of words. The cadence sounds like they're saying something, but the words don't make any sense. So it might sound something like this over that over there, and I was totally fine, and that's because of that. So they sound like they're saying something, but really there's no logic behind their conversation. And then typical aging, again, sometimes we have trouble finding the right word. It's on the tip of our tongue, and we're able to recall it later. And then number 7 is misplacing things and losing the ability to retrace steps. So exhibiting signs of dementia, they may put things in unusual places. So putting the milk in the cupboard, which honestly, I don't think that's pretty. I feel like I might do that if I'm tired or stressed. So maybe putting the milk in the bathroom or something strange. Or, misplacing the item and then not know when they do find it, not knowing what the item is for. A lot of times this leads to persons living with dementia to accuse others of stealing because they don't remember where they put their items, and they're not able to retrace their steps. And then typical aging, from time to time, we're going to misplace our keys, our reading glasses, our phones. I know I do it all the time because, I'm busy, I'm stressed out, and I'm got things to do, and I just didn't remember where I set it down. But we're able to retrace our steps and find them later. And then number 8 is decreased or poor judgment. So individuals exhibiting signs of dementia may, give away their money to strangers, be involved in scams, especially after you've explained to them what is going on and they just can't seem to understand. They may put a metal cookie sheet in the microwave or foil in the microwave. They might even steal things from the store because they just don't know that, their brain's not telling them that that's, not okay. And one thing that I find really interesting, I've heard some studies about how they're now equating this midlife crisis that we might see in someone as potentially early signs of frontal temporal dementia, because where the dementia begins is in the frontal lobe, which affects your ability to understand risk-taking behavior, consequences, that judgment part. And so when this person all of a sudden is maybe having affairs or gambling all the money away or going out and buying this expensive car, that's totally not in their character. It could be signs of maybe frontal temporal dementia, because that's not like that person, and all of a sudden they have this very decreased in poor judgment. And then typical aging, we are humans after all. We make bad decisions, we stay up too late, we might partake in things that we shouldn't partake in, we might we might plan things around rush hour. It happens, we're human. But again, this is occasional bad decisions, and this with dementia is, very drastic and usually not something that they would normally do. And then the ninth sign is withdrawal from work or social activities. So someone may exhibiting signs may start to remove themselves. They might be embarrassed, they might be ashamed, they might have some awareness that they are experiencing some changes and they don't want anybody to know. So they might stop attending their activities, stop attending church, stop attending, being engaged with their community. And then typical aging would be, especially around the holidays, we have lots of obligations, lots of people to see, and sometimes we just might not want to go to those obligations. Again, very different from the signs of dementia versus typical aging. And then lastly, we might see changes in mood and personality. So the mood and the personality of someone exhibiting dementia might change drastically. They may all of a sudden become suspicious, anxious, depressed, or fearful. Introverts may become extroverted, or vice versa. Extroverts may become introverts. We also see, someone who's maybe been maybe kind of mean or difficult to deal with their entire life, all of a sudden just become so receptive and loving to everything. So it can really affect the mood and the personality. And then typical aging would be more, we develop a specific way of doing things. We have our routines, we're habitual creatures. And when that gets disrupted, we might get irritated or annoyed, but it's not something that is our whole personality and is, again, something that isn't consistent. And what I really want to preface on these, typical aging versus dementia is it's really important to know the person. And you can see all these signs and maybe you're concerned, but maybe that's how that person has been their whole life. Maybe they've always kind of been a forgetful person, or maybe they've always been, their personality fluctuates, but it's really going to be dependent on who is that person and what changes are you noticing that are different than what you're used to. All right, so now we're not going to actually do this activity. I'm just going to go over it. This is just the 5 key messages of dementia friends. So our first key message is that dementia is not a typical part of aging. And so, yes, even though as we age, our risk of getting dementia does increase, but that doesn't mean that it is an actual normal part of aging. Some of us may become more forgetful during times of stress or illness, but dementia, again, is a different type of forgetfulness, and it's usually accompanied by all of those other symptoms that we talked about. It's really, really important that if yourself or you're noticing in someone else, you're noticing those symptoms, to go to the doctor and talk to them about the signs that you're seeing, because there are other things that may be causing those collection of symptoms. That's not a disease of the brain. It could be a urinary tract infection. It could be a nutrition deficiency. It could be thyroid issues. Depression can actually look like dementia. So it's really important to get a full, assessment and figure out what might be causing those symptoms. And then the second is dementia is caused by diseases of the brain. The most common is Alzheimer's. So like I mentioned before, not everybody who has dementia has Alzheimer's, but everybody that has Alzheimer's has dementia. And so Alzheimer's disease and those related dementias, they actually change the chemistry and the structure of the brain, and that's really causing those different parts of the brain to die off, which is not allowing the brain to communicate with each other and do the things that, our brain is supposed to carry out. And number 3, dementia is not just about having memory loss problems. It can affect thinking, communication, and doing everyday tasks. And number 4, it is possible to have a good quality of life with dementia. I think this is, I mean, they're all important messages, but I think this one is really important because, you know, from the exercise earlier and how most of us view dementia as very negative, very bleak. It's very much about decline. And so a lot of people are surprised that you can have a good quality of life with dementia, but it's going to take us. It's going to take the community. It's going to take service providers. It's going to take family members, care partners to change and how we communicate, how we engage, how we understand, provide that empathy and compassion for these persons living with dementia. There's a really great quote by Teepa Snow. She's kind of our global expert when it comes to dementia care and education. And she says, you know, dementia doesn't rob persons of their dignity. It's our reaction to them that does. And that has always stuck with me, and why it's so important to find ways to change how we perceive dementia. Because if we can't see that there is a quality of life that can be had, then those aren't going to be represented in our policies. They're not going to be represented in our programs and our everyday life. So it starts with us and how we look at it, understand, and find ways to bring out that person and that quality of life. And like I said, there's more to the person than dementia. So people that are living with dementia are a valuable part of the community. So in the same way we would look at someone with diabetes or cancer, we see them as a person first. And people living with dementia are people first. And we might hear, you know, there's a buzzword called person-centered care. And this is really vital when it comes to persons living with dementia. And what person-centered care aims to do is to understand who the person is, their history, their interests, what brings them joy, what matters to them in life. Because if we don't know who the person is, then we can't provide the proper care. So it's so important to reframe dementia and look at it as a person that has dementia, not a person that is dementia. Okay, and I'm going to share a video that helps, you know, just again to kind of reframe dementia and how we look at it.
For every human being, life is like a river. The constant flow of water represents our daily experiences, from routine and familiar to those that take us by surprise. If we're lucky enough to live a long life, we'll experience the river in each of the 4 seasons: spring, summer, fall, and winter. Spring is early childhood, when the river is new to us and we're just learning about all the fish, birds, and animals that connect with it. Summer is our experience from childhood to adulthood, when we transition from relying on others to navigating the water and harvesting for ourselves. Fall is adulthood, when we know the river and its resources and dangers well enough to provide for others, raise children, and chart our own course in the world. Winter is elderhood, when we've acquired the deepest knowledge and wisdom, but also start to experience changes from the aging of our bodies. Dementia is like navigating a river freezing in a long winter storm or even a blizzard. Storms can come in any season, although they're most common and most severe in winter. The wind and snow make it harder to see and hear the water. Everyday life, the natural flow of the water, becomes harder to navigate. Thinking activities that used to be easy, like planning a fishing trip, buying bait, planning meals for the trip, and reaching out to others to join the activity, become increasingly difficult. However, even at the start of a winter storm, emotional experiences and feelings remain strong. For example, the love of fishing, the memory of the sunlight bouncing off the rippling current, and the joy of company. The longer a person lives with dementia, the thicker the ice on the river can become. The everyday flow of experiences beneath the surface is more difficult to reach and navigate without help. Eventually, even deep and lifelong emotional and spiritual connections are harder to access through the thickening ice. This story of a river in a long winter storm helps explain the experience of dementia. Facts, recent memories, and complex thinking become harder to reach in the thickening ice, while deeper memories and emotions continue to flow under the surface.
Okay. Oh, I stopped sharing my screen. Well, I just think that is a beautiful yet realistic perception of what it's like to live with dementia. And, it helps us understand that while those facts and, the problems with judgment and reasoning and the ability to follow language is harder to get through the storm. It's not impossible, it just makes it harder. But under the surface, there's still that emotion and those long-term memories. And so with emotion, I just want to bring attention to it because, we could go visit our mom and who's living with dementia, and then we get an argument with her, and she's not going to remember what that argument's about, but she's going to remember how she felt. She's going to remember that she felt upset, that she felt maybe angry or sad, or that she disappointed you. And so even though she can't remember, she remembers those feelings, and that can set the tone for the whole day, the next couple of days, vice versa. Maybe you go visit your mom, you take her out to, drive to the ocean, to be out in nature and connect with nature. She may not remember what you did, but she's going to remember how it made her feel. It's going to make her feel connected to nature, connected to you, connected to maybe a higher power. And she's going to remember those feelings. She might not specifically remember where you went, but she will remember how you feel, how she felt. Okay. How are we on time? Okay. I was going to do an activity with everybody, but just for the sake of time, we are going to skip it. And just to give you an overview, kind of what this activity helps you understand is taking a simple task. So maybe you can do this on your own. Take a simple task and write down the steps. And you'll see how many steps there is just to make a cup of tea. Finding the kitchen, getting the water. Is the water going to be, do you make your tea on the stove? Do you have an electric kettle? Then finding the tea, then finding the cup. And if you're someone that's living with dementia, those steps can be very complex, even though that's something that we take for granted every day. And so when we are engaging with someone living with dementia, we don't want to completely take away all their independence. We want to support their independence, support their autonomy. So what are ways in which we can help them still be independent, make their cup of tea? Do we get all the stuff out for them so it's in front of them? Do we write down step-by-step directions for them? Do we go, did they use an old tea kettle back in the day, but you have a new tea kettle? Maybe we get them an old tea kettle, so that's something that they're more familiar with. So that's what we have to kind of look at with these things is, it's not that they can't do it. We just need to change the way that we are creating these environments and look at the abilities that they do still have intact. So now we are going to go over communication. And this is, really kind of the meat and the potatoes of dementia and how we communicate. So the ability to exchange ideas, wishes, and feelings, that is a basic human need, and that doesn't go away with dementia. But dementia does make it a little bit more difficult to communicate, and it's going to require a lot of patience, a lot of understanding, and good listening skills as the person engaging with dementia. And that can be really difficult, especially if it's maybe your spouse or maybe your brother or sister who you kind of already, you have a certain way of communicating, and having to change that might be really, really difficult. But it's really important that we find ways to communicate and bring out who that person is so that we can help understand what needs they need met. And so the ability to communicate for someone living with dementia will change greatly. Changes may include that they might use the same words repeatedly. They might invent new words to describe familiar objects. They might easily lose their train of thought. They may revert back to, a first language. We see this very often. And imagine if none of that family speaks that language, how difficult that can be. And really just overall difficulty organizing words logically. And when it comes to communication too, we may notice that someone is becoming more confused, maybe they're becoming agitated or maybe even aggressive. And we call these behaviors. And so we'll label them as, well, they're just really violent, they're combative, they're not cooperative. But really, this is the person's way of communicating. So if I'm caring for someone and I'm helping them get ready in the morning and I'm helping them put a shirt on, and they can't tell me that, oh, that hurts when you lift my arm a certain way, they're probably going to smack you. They're going to push you away. They might cry. And they can't tell you that. And so the behavior comes out, which is just their way of communicating. So we really have to kind of put on our detective hat and figure out, okay, why is this behavior occurring, and do a little digging. And it's not easy. It's going to take a lot of patience and a lot of practice, but just understanding that when these behaviors occur, that there is something more to what was going on, and to try and find meaning in that behavior. And so when communicating with persons living with dementia, this may seem very obvious, but treat the person with dignity and respect. They are a person. We don't want to use elder speak, talking to them as if they're babies. We also want to make sure that we're not talking past them. Even if they maybe can't verbally communicate, they can still understand. They can hear tone of voices. How would you feel if someone was talking in front of you? If there's talking in front of you about you, there's another slogan that's no care about us without us. So making sure we're finding ways to include them in their care. And be aware of your feelings. Your tone of voice can communicate your attitude. So use positive, friendly expressions, even just by saying someone's name a certain way. If I was to go, Swami, how's that make you feel? Swami.
You feel aggressive.
Yeah, you feel aggressive. Maybe feel like you're in trouble or you're doing something wrong. And maybe you're getting something that could be dangerous. And so I'm trying to get your attention. But if I went, Swami, hey, Swami, you're a little bit more like, oh, I'm curious. They seem curious. What's going on? And so just that in general can be can be very impactful when you're trying to communicate with someone. Be patient and supportive. If the person is struggling in their conversation, let them know that you're listening. Try and understand them. Show that you care about what he or she is saying and try not to interrupt. You can offer comfort and reassurance, letting them know you're listening. It's really important not to criticize or correct. That can just cause agitation and frustration, and it really doesn't matter. So try again to find meaning in what is being said. If they call someone by the wrong name, or what I see often is, looking for their loved one that has maybe passed away, and the person will remind them that, oh, that person's passed away. Well, we don't want them to relive that trauma and that experience. So find meaning. Maybe that person is just feeling disconnected. Maybe this person misses them. Maybe this person just wants some human connection. And so, finding ways around that conversation, maybe talking about the love of what they love most about that person to get them to talk about those and feel good. Avoid arguing. Again, this can just increase agitation and anxiety. They a lot of times have lost their ability to rationalize, to reason. So there's really no point in arguing. You can offer a guess when you're communicating with someone. Maybe you're noticing that there's just a word that they're just not getting. You can offer a guess if that brings them comfort. If you're noticing offering a guess makes them more agitated, then don't do that. And then encourage non-verbal communication. So thumbs up, thumbs down, point to things. Even body language can be a way of communication.
Rachel, just
Yes.
one question comes up here is that,
Sure.
suppose they are if you have dementia, what about hallucinations? Do you tend to hallucinate things? And if you do, which I've heard, then if a person starts speaking about things that are not in reality, things that
Mhm.
maybe so do you try to correct them about the
No,
reality,
good.
or do you just
Really,
stay with the
really
what?
great question. Really great question. And so, with persons living with dementia, depending on the type of dementia, there could be many reasons why there's hallucinating. We might see, especially in Lewy body dementia, because it really affects the deep part of the cortex. And so they might actually be hallucinating. But a lot of times, too, when I did that exercise, there's just things in their environment that they can't see. So we might think they're hallucinating, but we want to try and get into their reality always. We don't want to correct them. We don't want to tell them that it's not there, because to them, it really is there. So you want to validate what they're feeling. If the hallucination is maybe something scary, maybe they think someone's robbing or there's a burglar, then you want to try and make them feel safe and comfort them, and let them know, I'm going to take care of it. I'm going to make sure we call the police. There's things that you can do to bring them down so that they feel safe. And so that's what it's really all about, always trying to get into their reality and validate what they are feeling in that moment. Does that help?
Yes. And then
Okay.
what about if you notice that they keep forgetting things? Do you remind them about that they're forgetting, or do you just not even touch that subject?
Absolutely not. We do not want to remind them that they're forgetting things. They're not doing it on purpose. It's not intentional. They don't have control over that. That is their brain that is changing. And so I think that, that's kind of cruel to remind someone who has issues with memory loss, because they're not going to improve. And so if they're forgetting something, you just tell them to do whatever the thing is, or to grab whatever the thing is, or and it can be really, really difficult, especially for care partners, because what we also tell people is, you're going to kind of have to take the blame for a lot of things. You're the one that's going to have to apologize and say, I'm sorry. So you made this doctor's appointment for your person, you told them it's on this day, and now they forgot, and now they're upset and they don't want to go to the doctor. And so a lot of times you're like, I'm doing everything I'm supposed to, and now I still have to apologize and say, I'm sorry, I forgot to tell you that there's an appointment. I'm so sorry. That must be so frustrating. You know what, let's just take care of this, and then we'll go out to eat after and make something of it. And so it can be really hard, because we have to take the ownership. And that's what I keep saying: when we have to change, we have to do things differently. If we want the behavior to change, then we have to change. So we do not want to remind people that they are forgetting.
So it sounds what you're saying then is basically you really have to accept them as they are, unconditionally.
Exactly.
And the second thing,
Exactly.
then, it sounds like from a spiritual perspective, this is a really challenging in the sense that your own ego, you have to learn to
Yes.
let go of your own ego and just whatever the situation may call for, just dissolve your ego and be present with the person.
Mhm.
Basically, sounds like you're saying here, and just I don't want to say swallow, but learn to digest in a spiritually accommodating way. I'm sorry.
Mhm.
So yes,
Absolutely. No.
this
That
is
I love the
really
way
great,
that you frame that.
real good spiritual practice here. So
Mhm.
serving dementia patients. I'm sorry, go
It
ahead.
really is. It really is a good spiritual practice, and putting that ego away, taking a step back, asking for that guidance, and recognizing also too that you can't do this yourself. You need to partner with other people, partner with your higher power to provide you with that comfort and that spiritual guidance. So really, really great points and really great questions. Okay. So now, when we are actually approaching someone that is living with dementia, to start communicating, we always want to approach them from the front. If we approach them from the back or the side, again, remembering that peripheral vision, they might not be able to see you. That could startle them, make them feel unsafe. So you want to identify yourself, get in front of them, get in their field of vision. If they're seated, get down on their level, use their preferred name. I can't tell you how basic that is, but how effective that could be. And then we want to use short and simple phrases, speak slowly and clearly, use gentle and relaxed tones, and then patiently wait for a response. So just to let you know, it could take up to 20 seconds for someone living with dementia to respond to a question that you ask. So just so you know what 20 seconds feels like, it's a lot longer than you think it is. I'm going to ask a question, and then you can't respond until I tell you. What is your favorite book? Okay, now you can respond. You don't have to, but it could take someone 20 seconds just to formulate a response. So if we're asking multiple questions at a time, if we're asking a question and we're just kind of trying to hurry them along, or, eye contact, we always tell people to maintain eye contact, but maintaining eye contact for 20 seconds is very long. So making sure that we're aware of our body language, where we're looking, making them feel comfortable, not feeling like that they're pressured, because if they feel that, then they might not want to engage. They might isolate, they might shut down. And so something as simple as just understanding it could take a while for them to respond can really help promote someone's engagement. Okay, and one more on communication. So when communicating during the conversation, you want to provide specific statements. So instead of saying, do you need to use the bathroom? Because what are they probably going to say? No, we're going to say the bathroom is right here. Avoid using confusing or vague statements. So instead of saying, hey, come here, say, hey, come next to this desk. Give choices. This is really important, to give this or that choices, because that helps them feel a sense of ownership and, again, independence. And we all want choices. We don't want to be told what to do. So, would you like water? Would you like coffee? Would you like chicken or steak for dinner? So, that's very simple, but giving them options so that they have a choice. And then turning negatives into positive. This is really key. And I think a lot of these we can use in our everyday life, not just with persons living with dementia, but I had someone recently who was living with dementia tell me that her and her husband used to get into it a lot because he would always tell her, don't do that, don't do this. And she said it made her feel like she was a child and she was in trouble. So she would just shut down and not want to talk to him. And it created a lot of tension in their relationship. And when he started recognizing, turning things into positives, and just, again, like you're mentioning, putting the ego aside, letting it go, they said that their relationship has actually been the best that it's been. And they've been married for over 50 years because it helped them to really connect deeper and learn a different way to communicate that was, more effective for both of them and positive, and really reach the spirit and the core of who they are. And then you can also give visual cues. So again, pointing to things like we're mentioning, avoid quizzing, kind of similar to, asking or, reminding them they forgot something. It's not good to ask them to remember certain things. You can reminisce about the good times, but asking them, do you remember this? Do you remember that? It's kind of the same as reminding them they've forgotten something. And then you can use written notes and pictures to help with communication as well. And I really do want to show this video, but I think we're running out of time. So I will send it to Swami. It's a really, really great video on understanding behaviors. And it's very eye-opening. And I've seen so many light bulb moments of people just having their aha moment of this really makes sense. So I have time to do it. And
How long?
just a reminder.
How long?
Yes.
How long is it, Rachel?
It's about 5 minutes. So it's up to
Why don't you go ahead? Go ahead.
Okay.
Yeah.
Commercial.
Challenging behaviors. That's how we see it. They're misbehaving. They have problem behaviors. We've got to do something about this. Now, I'm going to call a timeout right now, because the biggest problem we have right here is you've already identified the source of the behavior. You're pretty sure it's them and what they're doing. Timeout. You need to take a step back and realize this is much more complicated than you think And instead of being such a strong judge and jumping to conclusions, what I want you to do is back off and reframe this. I want you to realize that they're doing the very best they can to try to communicate with you, to meet a need, to express that they aren't liking what you're doing. And unfortunately, you simply see it as not getting your way. What you don't realize is that you started this very frequently in your effort to be helpful. Let me just say to you, you weren't as helpful as you thought you were. I didn't really enjoy the help you gave me. I didn't get it. So you have a choice right now. Are you going to continue to push your agenda to try to get where you want? Or can you take that step back and go, okay, well, this isn't working. Let me rethink. So what you want to do when you experience a behavior you're not liking, you need to, whoa, take that step back. Take a deep breath, let it go, and realize now it's time to kick in the front of your brain and to become a really good detective. Try to figure out what might be driving what you're seeing, what you're hearing, what you're feeling, and what they're feeling. What maybe you're smelling and they're not picking up on, what they're tasting versus what you would be tasting. Because what you want to do is realize that you need to see it from their side. And once you see it from their side, you try to be in their shoes, figure this out. Suddenly, when you see things, hear things, experience things differently, and you make that choice, that decision to do that, the uh-oh becomes an aha, because you can start to realize it's the setting, it's the care, it's the gem. It's who they were before this all started. There's lots of pieces to the puzzle. Your job, if you want to do this well and do this over the course of this condition, is to stop the judgment, time yourself out, and reframe this behavior. Go from a challenging and frustrating, I just don't understand why she's doing this, to pausing for yourself, getting some help, maybe getting somebody else to take a look with you, because maybe you just can't see it because of who you are and how it works. But what you're going to do is take that step back, look more broadly, and at that point, make a decision. What are they trying to do? Are they communicating an unmet physical need? There's basically 5 of them you want to learn about. Or an unmet emotional need. Or are you seeing the emotional need, but you're missing the physical need? Or was it something that is happening in the environment or happened earlier today? As I said, complicated. So you need some training. You need to know what's going on and what's not going on so you can quit sitting in judgment and start using this. That's the best tool. That and your ability to bring people together to help you. So with challenging behaviors, it's not about them, it's about us and what we choose to do about this effort to communicate an unmet need and helping us figure out what is the need and how can we better meet it for success for both of us. Making a positive difference because we choose positive approach to the care. Now remember this lady? What do you think she's doing? You see her beating on the chairs, making noise, annoying people, and you know she needs to go to the bathroom. It's been a long time. You've tried to make her stop, but she won't. What if I told you she used to clean houses for a living? I'm going to try substitution and a positive approach rather than trying to make her quit.
Miss Leona. Well, hey there.
Get your hand.
Get my hand out the way. You're trying to get them clean. Here, try this.
She's a busy woman.
There you go.
I'm going to
that.
try a substitution here.
I'll trade you.
Not yet. Show her.
Rub it with that. Can you rub it?
Yeah.
Here, rub
We're
it.
getting there.
Trade me.
Wait.
Trade me. Here you go. Take this.
All right, give it.
You got it. Now trade out. There you go.
Ta-da.
Now rub it.
Now I show her, and there she goes.
There we go.
People
Good.
are less annoyed, not so much noise. And she's
Beautiful.
cleaning. Now I want to reinforce it. That's
Got
good. That's good.
2 more to go.
But I still haven't met
You're doing a fantastic job.
her unmet need. One more substitution.
Nicely done, Leona.
She needs to get finished with this
Boy, you are good.
so we can move on.
You get this one?
Watch me, I'm sneaky.
That's it. Good. Good.
I visually eliminate the task.
Whoa. Woo. That is beautiful. You did a fantastic job. Man, you're a good cleaner.
Here.
Thank you. All right, well, come with me and we'll sit down and take a break.
Oh, God.
I know you're ready for
I'm
one, aren't you?
tired.
Now, before she goes to sit down, though, we have a place to go.
Oh, girl, you worked hard.
Oh, God.
You are one of the hardest working women I've ever met.
Yeah. Uh-huh.
Well, Lord knows. Let's go to the ladies before we sit down, though.
Okay.
Okay.
We changed the challenge.
All right. I love that video, and I think it's so telling. And just what could have happened if Teepa didn't intervene the way that she did, and how that could have become such an issue. You saw how she got agitated when Teepa tried to take the maraca, and those situations happen all the time. So just allowing ourselves to look at it differently, know who the person is, keep trying different things. And a lot of times with dementia, it is a lot of trial and error and trying different perspectives and different angles to try and understand what's going on. So I know we're out of time. Do you want me to finish? Probably have like...
I want you to continue. Finish.
Okay. So anybody obviously that needs to log off can log off, but there's probably about 5 more minutes left. All right. Okay, so I did want to touch base just a little bit on dementia and spirituality and religion. And, I'm sure it comes to no surprise how important and impactful that this can be for persons living with dementia, especially if this has been a major component for their life. If this is, something that is really a part of who they are, making sure that we're finding ways to keep their spirituality and honor their religion in the progression of the disease. And religion and spirituality in itself can be just so profound and really provide comfort and meaning, especially with prayers, meditation, those rituals that we see, is just so vital. And I experienced this with my grandma when she was on her, her last days, and she was a very, very, very Catholic, and it was very much a part of who she is, and how much peace and comfort that brought her, being able to have that. And so they might, as a person living with dementia, they might not be able to initiate those things. And so we need to find ways to make sure that we are still including them in, certain practices. Maybe they can't get to a certain church. Can we find ways that we can create spaces in our own environment where they can still practice and be a part of that? Spirituality and religion can also help with a lot of those emotional changes, with helping with anxiety, helping with, the grief and the agitation. I know you did the chant earlier, and, I learned from the presentation that you did, Swami, at the seminar that you did, and how that stimulates our vagus nerve and all of those things. Like, there's physical things that actually have meaning that can help with these emotional changes that are part of these religious and spiritual practices. And then this also helps individuals to, again, really foster that connection and sense of belonging, and that they are a part of something bigger, a part of something greater, and supporting the identity. Like I mentioned, my grandma being very Catholic, that was very much a core of who she was. And so we needed to find ways so we could support her, even though she was dealing with dying and decline and all of that. And then spirituality can also encourage just that holistic care. Obviously, being in the Western world, medication, and there's certain way of doing medical practices, but spirituality has that holistic element, and that can encourage maybe better care for that person, because that is what is important to them. So utilizing our spirituality and religion to help individuals and engage and support them even more in who they are. And I think the biggest takeaway is finding is they might not be able to do it themselves, so we need to help them with that initiative and create those spaces. So that is it for our dementia friends. So you are all official dementia friends now, who support the 5 key messages, And what being a dementia friend is really committing to your own action, your own dementia friendly action. And what dementia friendly means is just, doing something to make our society more dementia friendly. So it could be something as simple as I'm going to start referring it to a person living with dementia, not suffering with dementia or demented. It could be that I'm going to maybe more drastic. I'm going to volunteer for someone who is living with dementia to provide some spiritual guidance or pray with them once a week, whatever the case may be. So this is where you get to turn your learning into action and start implementing it. And usually we share all these things, but again, for sake of time, here are some resources in San Diego County. I know not all of you are in San Diego County. We are Aging and Independent Services, so we are area agency on aging, and every state has an area agency on aging, so you can check with your local, and that's they provide a lot of different programs and services for older adults. Alzheimer's Association also is a national organization. And then Teepa Snow, she's the one in the video. She's a national organization as well. I would encourage you to check out her website. She has so many great educational videos. She also has an amazing podcast. I know that I'm one. I love podcasts because it's easy just kind of put on and digest it. And what's really great about hers is they're only like 10, 15-minute episodes, so you don't have to oversaturate yourself and listen to someone talk for an hour like me. But she has just some really great takeaways. So now, you're a dementia friend. I do have an evaluation form, and that will allow me to also send you your dementia friend certificate. And if you do want some swag, we have bracelets, pins, stickers. If you want that, you can put your address and I can mail it out to you. And now if you do have questions, I will remain online just in case. So I really appreciate all of you being here and learning and being a part of this Dementia Friends movement. It's a small step towards creating these dementia-friendly environments, and you're a part of it.
So, Rachel, thank you so much for this really very informative and very inspiring presentation.